My name is Ryan Thompson. I'm a physician at Mass General Hospital and I'm the medical director of the Mass General Home Hospital program. Home Hospital is a program that we started at Mass General in 2017. It's a service that provides care for patients who would otherwise be admitted to the hospital as an inpatient, but we're able to deliver this care for patients in the comfort of their own home. We have a team of physicians, of nurse practitioners and physician's assistants, and also home care nurses that work with our team that visit patients on a daily basis, sometimes multiple times a day, to deliver their care at home. There's a lot we can do today in the form of IV therapies at home, oxygen monitoring, vital sign monitoring, that can help patients stay at home where they're more comfortable to be able to overcome whatever acute medical illness is facing them.
My name is Carol. I have just recently had an experience with Home Hospital. I have been admitted to the hospital many times for many different things. But when you're in the hospital, you're kind of anxious all the time. You don't know what's going on. People are coming and going, and you're trying to find out exactly how you're doing. And with this, I found that being home made such a difference. When the nurse and nurse practitioner were here, they checked my lungs, they checked my heart, blood pressure, oxygen, and everything that would let them know if there was any problem. They checked my sugar also. They were here every day, and I know they were in contact with my primary care physician and my kidney doctor. I felt very safe because I knew they all left me telephone numbers that if I needed to call anybody, if I had a problem, they were as close as a telephone call.
When you're at home, our team rounds on you as we would round on you in the hospital. We will send a physician who would visit you once during the first 24 hours of the admission, and that physician otherwise will guide the team of nurse practitioners, physician's assistants, and nurses who would then visit you on a daily basis to deliver medication, to deliver other monitoring, to monitor laboratory values, and we can even do imaging studies in the home, such as a chest x-ray or an ultrasound if that's what's needed. If everybody is agreeable with this, we would admit you to Home Hospital just as you would be admitted to the inpatient setting, but you would be transported home, where our team would meet you at home and would immediately pick up your care and begin treating you as if you were in the hospital. Usually, Home Hospital patients are admitted to the service for about 3 to 5 days, which is a fairly normal hospital stay for our patients. The difference is that you get to rest and recuperate at home, eating food you're comfortable with and being in a place where you are comfortable. It really is a model of care which works great for the right patients. They have a very good experience, and the healing process begins even earlier because of the presence of the patient at home.
I actually feel like I was getting more care and more attention than if I was in the hospital. But I was so glad when my doctor called me and asked me if I would try it this way. And I would highly recommend it. And here you get your questions answered right away. So if you had any anxiety about anything, they would really make you feel better.
My name's Ali Raja, and I'm an emergency physician here at Mass General. I'm the vice chair of the Department of Emergency Medicine, and I get to partner with the Home Hospital team in a lot of the great work they do. I've got to tell you, the Home Hospital program is exceptionally safe for our patients. It's got a great track record, and most, if not all, of the patients who are taken care of on the Home Hospital team really seem to prefer it. But it's not just preference. It's really and truly good for the patients and for the clinicians taking care of them. For the patients, well, you get to be taken care of in your own home. And for the clinicians, we get to learn things about you that might be contributing to your health. We get to talk about the environment in which you live and see and take care of you there. In the emergency department, we're really 100% on board with this as well. If you come into the emergency department, but we actually find that you're well enough to be taken care of at home, we want to make that happen. The hospital's crowded. It gives you great care, but it's also really crowded, and you have to wait in the emergency department. You might have to wait upstairs. And sometimes, especially if you don't need that and can be taken care of at home, it's really in the best interests of both you and the clinicians to get you home.
When you have to go to the hospital, just hearing that sentence can really make you scared, and I feel that this is really the way of the future is to handle it like this.